Autism Research Coalition. Today we are very lucky to have Netsanet Mulugeta with us today. She is a board certified, thank you for joining us, I'm going to give a little background on you. She's a board certified pediatric nurse practitioner with Lighthouse Complex Care. She has spent over a decade in the medical care of the pediatric population and as a mom to a medically complex child. She has spent thousands of hours researching both traditional and functional medicine approaches with access to resources not available to the public. Her own experiences have made her even more passionate about helping medically complex patients. She has centered her care for the pediatric patient to be holistic to help promote a healthier recovery. Thank you so much for joining us. We're just so happy to have you and to hear everything about Lighthouse and how you're helping children across the U.S. and beyond. So please take it away.
All right. Thank you so much for that introduction, Jessica. And I want to say thank you so much to the Autism Research Coalition for having me today. Today, I'm going to be talking about the multidisciplinary approach to diagnostics and treatment of autism spectrum disorders. Before I do start, I just want to just a simple disclaimer that this presentation is only for educational purposes and information purposes only, and not to be construed for any medical advice, and always want to consult with your physician. So before I talk about the multidisciplinary approach, I want to just share a little bit about myself. I'm sure a lot of people don't know me, so I just want to give a little introduction. I am a pediatric nurse practitioner. I've been working in pediatrics for over 14 years now. So it's truly my first love, my passion. I truly love the pediatric field. I actually started in, when I became a nurse practitioner, in a multidisciplinary team for a pretty large institution, our children's hospital, and I worked on a craniofacial team. And the experience I got there was just amazing. I worked on a craniofacial team with 8 to 10 different specialty providers. And what was really nice about it is that, when a patient would come in, with a cleft lip, cleft palate, a lot of times they were complicated, syndromic, and we would see them, and they would come once a year, and they would be able to see all the providers in one day. So it was just a one-stop shop where they saw 8 to 10 different providers. And during that time, I would, kind of be the practitioner or the pediatrician and do a full exam on the patient. And after the patient has seen everybody, they would leave, and then us as the providers would come together, and we all would sit around a round table, and I, as the case manager, would also ask, ENT, what did you think? GI, what did you think? And at the end of it, I would write a care plan to give to the family. And so that multidisciplinary approach, I saw how helpful it was. And it was just nice for the patient also to be able to get everything, in order for 1 year. And so I promised myself if I ever got into this field that I would want to bring that, experience that I have to the autism field, because I understand how complex of a diagnosis this is. And so that's what we did when we opened up Lighthouse. I'm currently now practicing at Lighthouse Complex Care. We're an integrative clinic. But before, again, I get into the multidisciplinary approach, I do want to share my personal journey of what I've been through. As you can see this picture, this is my son. This is my reason why of what I do, and how, Lighthouse even came to be. So when my son was about, I would say, 2 years old, we noticed a lot of, signs and symptoms, red flags, not turning to his name, lack of speech, no real social interaction. He ate maybe 2 to 3 foods, was not sleeping at night. So kind of all the signs and symptoms, you see in the beginning. And even though I was a pediatric, practitioner, I had all these years of experience. It's different when it's your own child. And so I remember asking my colleagues and saying, hey, what do you think? And the feedback I got was, you've been in the field so long, you just know too much, you're overanalyzing. And to be honest, it was much easier to hear that than to hear that my child may be on the spectrum. And so I went with that for a little while. But the more signs I started to see, and the more I feel like he became lost in his own world, I did, seek out his pediatrician, who happened to be a former colleague of mine at the time. And so I went in, asked, and kind of got the same feedback of, Netsy, you're overreacting, you know too much. Plus, boys are a little behind sometimes. He may, have some speech delays, but nothing to worry about. And so again, I went with it because it was the easier thing to hear at the time. And so I ended up waiting a few more months, and then I was actually advised at that time to put him into, a preschool. So because he's the first child, no other kids in the home. So then the other excuse was, oh, he's not playing with his peers. That's why he's not talking. So we did that. About a month into it, the preschool teacher came up to me when I was picking him up and said, hey, Netsy, have you noticed, have you ever got his hearing checked? Because I don't feel like he's answering to his name. I don't feel like he's responding. And so that was finally my, I finally felt like somebody saw what I was seeing. Even family was saying, he's a boy, he's going to talk a little later. It's okay. So when she said that, I had my connections at Children's Hospital. I got him in right away, got him a hearing exam. And as many of you probably know, his hearing was perfect. A lot of our kids on the spectrum don't have actual hearing loss, maybe selective hearing, but not hearing loss. And so once that happened, we went back to the pediatrician. And I was advised at that point to maybe just start some speech therapy. We did that. A few months into that, more regression. Didn't see any kind of progress at all. No words, nothing. Behavior worsened. I started seeing stimming, flapping, toe walking, peering, lining up, everything. So at that point, I decided to seek out a pediatric, or a developmental pediatrician. And so she did the referral to get him assessed. And at the same time, I lived in California. So there's early childhood services called through the regional center. So I simultaneously had him examined there at the same time with his, the developmental pediatrician. And when we got back the results, both said the same thing, severe autism. And to my surprise, I actually was happy because I finally felt like somebody believed me and somebody saw what I saw. I wasn't crazy. And, in that time I was working in mainstream medicine. And from what I know and what I learned in school is your child's on the spectrum, you get them into all the services. You do 40 hours of ABA, speech, OT, feeding therapy, music therapy, all of it. And I did it all, floor time. And we hit the ground running because I really thought in that time, if I get my kid all the therapies, he's going to get better. We're going to see progress. So that's what I did. I, went full force. We did all the therapies. And about 6 months into that, we still saw regression. We still saw delays, delays that were continuing to grow. So at that point, I did a deep dive, internet, Dr. Google. I was just looking for answers. And the reason why, it's not that I had a hard time accepting my son was on the spectrum. I think what it was is I knew my son was in pain. I can tell, when he was waking up at night, it wasn't just waking up. He was moaning or crying, kind of holding his tummy, and I knew something was wrong. I could tell when he was agitated during the day, hyperactive or stimming. It's not because he was happy, it looked like he was not in a good place. And so that's what I was looking for answers. Like, is there anything I'm missing? And I happened to find the website, the TACA organization website. And I started reading and just found so much, so many articles, evidence-based articles, information saying that there's underlying issues with autism that can cause these outward symptoms. And from there, we just never looked back. I decided at that point to put him on a gluten-free, dairy-free diet. I didn't, think it was going to be harmful. So I said, why not? Let's try it. My husband probably wasn't really on board in the beginning, but, he supported the idea and said, fine, let's do it. And within a week of us taking him off of dairy, we noticed his eye contact come back. And we had been working on eye contact for 6 months at that point with ABA and nothing. To the point they were grabbing his face and trying to direct him to look at them. And I used to say, don't do that, because that's not how it happens in the real world. Nobody's going to grab his face and say, look at me. I want it to be fluid and natural. And so, therapy, sometimes there was a lot of back and forth of, we want it to be play-based and natural. But with that being said, I did learn about underlying issues. We started the diet. Within a week, we saw eye contact. I would say within 2 to 3 weeks of taking out gluten, we started seeing a few words coming in. And that's why me and my husband said, you know what, there's some truth to this. There might be more that we can do. And then I, again, because of my background, I did deep diving searching and looked for evidence-based articles. And I did find so much information out there. And it happened to be, just kind of worked out that the TACA conference was just a few weeks away. So I signed up, went to that because I lived in Southern California. So it was like meant to be almost. It was 30 minutes away. Went to this conference, and again, I just felt like this light bulb went off because I had no idea that this even world existed, that there was underlying issues that we can address. And I remember hearing just, leaders in this field, amazing talks, by Dr. Usman, Dr. Rosignol, Dr. Fry. And I just left that conference with so much hope, feeling like there was something I can do for my son. I remember leaving with every kit that they had. I left with an oat kit, I think a Genova, a Frat, and a Mido swab. I mean, I was ready to find out what these underlying issues were. But like I'm sure most of you know, when you go to your actual pediatrician, and that's what I did, I left this conference, went to my pediatrician, so excited to share this information. And I got pushback. I got, what is this? These are not conventional tests. We don't do this. Didn't really believe in gluten-free, dairy-free. Pretty much, this is autism, except your new normal. So, I wasn't discouraged just because I did expect it a little bit, but I was hoping, they'd be a little bit open, especially to conventional testing, blood work. And so I did ask for, some of the things I learned about, like the copper zinc ratio and wanting to have, his vitamin D and his iron and all of these things checked. And again, I got pushback of why do you want those tests? He doesn't need those. And I said, well, my kid eats 3 foods, he probably has nutritional deficiencies. And I did ask for further testing. Didn't happen. And mind you, I'm a practitioner. I work in the field, and I still couldn't convince the provider to order these tests. And so luckily, I had just came from the conference. And so I went and printed all those articles that I had, the evidence-based articles that was presented at TACA. And I said, hey, this is why we need to check the cholesterol. This is why we need to check copper and zinc. This is why we need to check vitamin D, and showed the correlations with autism. And finally, he couldn't say no. He didn't draw all the labs I wanted, but a majority of them. And again, to no surprise, he was deficient in so many areas, vitamin D, iron, ferritin, so many areas. Copper zinc ratio was off. And so we, at that point, decided to supplement. And every time I supplemented, thank goodness, my son he responded. And my kiddo, who never slept through the night, started sleeping for longer stretches, and that was just with vitamin D and iron. These are basic supplements, basic vitamins. And so again, I felt like, okay, there's some truth to this treatment. We have to keep digging. And I noticed when he was waking up, he wasn't as in much pain. And I noticed a little bit more focus too. So then I found, a biomed or MAPS doctor in my area. And we started really tackling the tests, going through test results. But again, on the opposite side of the spectrum, kind of what I was met with function or biomed was sometimes it would be very symptomatic, saying, oh, your kid is itchy, or they're playing with their saliva. It must be yeast. So let's try some nystatin or diflucan. And I didn't feel comfortable with that. I again, coming from my background, I wanted tangible results. I wanted to go off of data. And so that's what I did. I kind of incorporated my own style as I was, trying to recover my son. And when I would be told, just give this supplement, I would do a lot of research, and I would do further testing. And if the testing matched what the supplementation, recommendation was, then we would treat. And so as we did that, it took us about 2.5 years. And so we started this journey when he was around his 3rd birthday. And by the time he was around 5.5, he, was able to begin kindergarten with his class. He was talking, has full sentences, able to play with his sister, and plays with his peers. You probably couldn't really pick him out, with any neurotypical child now, graduated from all of his therapies. And so he's now in managed recovery. And what that means, and I always have to explain this, is that it doesn't mean he's just recovered and we stopped his diet and we stopped all his supplements, because that's not what's happening. When we were going through this journey, we found what his body needed. Some things maybe for the rest of his life, some things were just in that time when we were dealing with some pretty, chronic health issues. And once they resolved, we can stop some of those supplements, medications. But his diet, he's probably going to have to be on this special diet for the rest of his life. And he's going to have to be on a handful of supplements. So that's what I mean when I say managed recovery. But to us, that's worth it. If that means my son has true health and is able to function and go to school and learn and talk, to be honest, I didn't think that was going to happen. I didn't think my son was ever going to talk or be potty trained. But here we are. And so once that happened, and once we were able to recover him, I promised and vowed myself that if I ever got there, I would want to work in this field and I would want to give back. And I want to incorporate that multidisciplinary approach, because even on our recovery, journey, I noticed when I had multiple providers involved in his care, meaning I had a GI at one point, an ENT, all these providers were not communicating. Nobody was talking to each other. And I felt like I was the liaison telling them, this is what so-and-so said, and this is what, and because of that, sometimes I felt like things would slip through the cracks. And I just couldn't imagine, how much more, how many other parents are, dealing with this with their children. So after I recovered him and, we were in a much better place, it just kind of, again, right time, right place. I met a few other providers, like-minded providers who were also, wanting to open a clinic and wanting to incorporate this multidisciplinary approach also. And so that's how Lighthouse was birthed. We opened about 2 years ago, this September, in a month. It will be our 2-year anniversary. And that's part of the reason I moved from California to Colorado was, to start this journey and open this clinic. So that's kind of how I got here. And moving forward, I just want to talk about our multidisciplinary approach at Lighthouse. We truly believe autism symptoms can be medical and treatable. Autism is a very complex disorder that may involve many medical, genetic, and environmental factors. Autism is a developmental disorder that affects behavior, communication, and solely diagnosed by behavioral observations only and no actual medical investigation. So yeah, unfortunately, the medical diagnostics or assessment is not happening. They usually neglect the investigation or underlying comorbid conditions and focus more on the behavioral manifestations. Our clinic, Lighthouse, we specialize in determining the medical causes that produce the behavior or the psychiatric outward symptoms. And there are multiple biomed abnormalities that have been found through evidence-based research, and most can be treated to some degree. By identifying these underlying causes through testing and treatments, many children do improve. Even in these short 2 years, we've seen so many kids, make so many gains, meaning kids who weren't talking now are talking, kids who weren't sleeping are now sleeping, kids who are eating 2 to 3 foods are now expanding their palate and trying new foods. And so it's not overnight, but we do see usually over months and even years, a lot of improvement. Some individual treatments can show great benefit. So like working on the gut definitely could show great benefit, but really looking at that holistic multidisciplinary approach is, and looking at the various treatments to see, that's what it takes to see, that substantial result, or to see the gains where you don't get the waxing and waning, where you actually, keep the gains or able to build on top of that. At Lighthouse, we do have a multidisciplinary approach to treating autism. This approach is basically a biomedical, or a biomedical approach where, we're starting pretty much from the bottom up. We're starting with the gut, what goes into your mouth, down into your gut, and then down to a cellular level. And so this pyramid in the beginning focuses on gut imbalance and diet. If you already come into the clinic and you're on a gluten-free, dairy-free, egg and soy-free, those are the 4 we usually really focus on because they're the most inflammatory foods. We won't ask you to do, further testing. We'll just say, continue that diet. But if you come in and you're a brand new patient and you've never done any kind of testing, we will ask you to start there, to start with the diet. We never will say just go gluten-free, dairy-free without testing. We always test first. We have a motto, test, don't guess. So We test first, we look for food sensitivities, and depending on what comes back positive, that's what we ask you to take out of your diet for at least a 3-month trial, because it takes sometimes 2 to 3 months for gluten to even, not cause that inflammatory response anymore. Gut imbalance, this is where we're looking at, gut dysbiosis. So this is yeast, bacteria, parasites, all these inflammation we see on the test. We also will see, sorry, I lost my train of thought. So we see all these different infections. We'll see things like leaky gut, inflammation, those kind of things. And depending on what we find, that's what we're treating. So we're very individualized in the treatment plan. And why we always start with the gut is because 80% of your immune cells are there. And so we want to make sure that we get your gut to homeostasis and to a good place, before moving forward. The next area we look at is nutritional deficiencies. With nutritional deficiencies, this is very common, again, in our population, just because a lot of our kiddos only eat a few foods. They have sensory issues, smell, taste, everything. It's too much. And so they only have a few food groups that they're eating. And so we do a full lab set in the beginning, or probably around your second visit, where we're looking at, B12, vitamin D, copper zinc ratio. We do a few immune labs. So it's a pretty comprehensive lab set to look at what deficiencies there may be. We also look at detox markers like glutathione, homocysteine, things like that, to truly get a full picture of what's going on with the child. The next area we look at is B12 and folate processing and metabolism. So that's like a FRAT test, which is a folate receptor antibody test. And this is where we're evaluating for cerebral folate deficiency, which there has been a lot of studies. There's a lot of information about it and how it relates to autism. And it's just such a simple one to treat. It's B12 and folate, really, and high doses of it. And we really do see a great response, actually, with speech, communication, mood. And so it's one of those that we do also try to rule out earlier on. The next area that we look at is the mitochondria and metabolism. So this may be, an oat test, a mito swab, things like that. And depending on what comes back, so if you have like a complex 1 or 2 deficiency, that's what we're supplementing. If you have a complex 3 or 4, we're trying to upregulate that. Or if your citrate synthase, is low, then we're going to try to raise that. And if it's high, we're trying to reduce it to reduce that oxidative stress. So that's another area that we really, find is very important. A lot of times when we treat the mitochondria, I see a lot of physical gains where kids actually are gaining weight, are able to be more active, like where the, OT, PT is like, wow, these kids, they're finally able to ride a bike and run and not be tired and pooped out, So that's really a nice one to also treat, just because we do see a lot of gains in that area. The other section is environment and infections. And so environmental means like, mycotoxins or heavy metals, or we're ruling that out. We also are doing a full, panel for infection. So this is like a PANS PANDAS workup. And so we are doing a full infectious panel, meaning bacterial, viral, co-infections, Lyme, Bartonella, the whole thing. And depending on what we find, we'll start treating those, one by one. And then immune balance. We try to do as much as we can in-house. And so we will look at, the immune system, and we'll see if there's anything that we can do or help to boost the immune system or even calm down the immune system, depending on what's going on with your child. But we understand our limitations also. And so that's where this multidisciplinary approach, comes in, is that when it's kind of beyond us, we've made relationships with other practitioners. So whether that's a GI doctor, ENT, dental, all these different areas that our kids, are dealing with, we refer out. So if your child, their B cell, T cell, or natural killer cells are off, or IgG deficiency, those kind of things, then we'll refer you to an immunologist who can provide your child, IVIG, or if they have an autoimmune condition and need IVIG or rituximab, that's what we're doing. We have an amazing immunologist here in Denver that we refer a lot of patients to. We have a lot of families who actually fly in to see him just to have that first evaluation, get them set up with IVIG or rituximab, and then when they go back home, they will, continue that care through home health services. And so again, that's something that we do, is we make relationships with different providers to help our children, our patients. You'll notice I say a lot of times our kiddos or our children, because my patients are like my babies. So when I say our children, I'm talking about our patients. That next area is genetics. And so we have a genetics department that basically will mine data. So if you have WES, data, whole exome sequence, or microarray, or SNP panel, things like that, you can send that information to us and we will reevaluate it. A lot of times with WES, depending on where they've kind of probed it, they've only looked at one section or two sections. So what our team does is, we go back and do a full, look at all the symptomology, look at all your labs, find out what areas to really focus on, and go back and remine that data to see if we find anything. And you'll be surprised. I will say a majority of the time we do find something. Something else pops up that didn't come up on the first, run through with the genetics, originally with your geneticist. The last section is neurological reorganization. And it's not to say that it's last, it's just that neurological reorganization is things like speech, OT, ABA, neurofeedback, all of those kind of things. And so with that being said, a lot of times patients, by the time they've come to us, they've been in therapy, for years, and they're looking for something different. They're looking for, further testing. And a lot of times therapy at that point is not working because their child can't sit and attend and focus because they're in pain, or they have brain inflammation, or they're dealing with a PANS or PANDAS, exasperation. And so how could they, be successful in therapy when they're dealing with all these underlying issues? And so what I usually tell my patients is, I don't want you to stop those therapies, but this might be a great time for you to really focus on all the other, underlying issues, treat those. And what I found is that as we deal with those issues, a lot of times kids do better and better in therapy, and then we add in more hours. And then also we start truly seeing where the areas of deficit are, because in the beginning, we're treating symptoms, again, that are arising from pain, arising from GI distress, from nutritional imbalance, from mitochondria, fatigue. They can't stay up sometimes. They can't focus. They don't have that brain power, that energy to focus. And so that's why we found it so important, to look at all of these areas. Another area that I didn't mention, which is outside of the pyramid, is inflammation and detox. And not to say that inflammation and detox, the reason they're outside of the pyramid is because we have found 99.9% probably of our patient population deal with these. The things in the middle of the pyramid, it's subject to testing, meaning they may have some really bad gut dysbiosis, they may not. But a majority of our kids do come in with pretty high inflammatory signs and symptoms. They, testing, either calprotectin, ESR, things like that have come back high. And then also detox impairment. And so we do in the beginning, work on natural ways to, push detox, and also how to, reduce inflammation. For detox, we also do further testing. Like I mentioned earlier, we can check homocysteine, glutathione levels. We can also look at, your CMMT and your, MTFHR status, just to look at how your child's detoxing and what the best B12, that they can, or, what methyl donors they can absorb best and things like that, because not every child should be on methyl B12. Maybe they are better with hydroxy, or maybe every child doesn't do good with methylfolate. Their genes might be set up that they should have, folinic acid or leucovorin. And so that's why, again, we have this motto of test, don't guess, because if the further or the more we have information, the more data, we can really, hone in and individualize the care for your child. The second part of this is, so this is a lot of the in-house, multidisciplinary care that we do. But the second part of this is that basically is that we work as a case management team. And what that means is we have, back office, we have a research team that actually helps, with mining data, with getting information. When you guys send us hundreds of pages of data, they help us to kind of, look at the pertinent information and things like that. So we within us even have, a back office and a team that works together. But also, say your child, is seeing the ENT and also seeing an ENT's recommending ear tubes. And dental is saying, your child needs to get some, cavities filled. And we know that your child's a very hard stick. Nothing, no sedation, nothing will keep that, child down for a blood draw. So this is where the multidisciplinary approach comes in, is we become the liaison for your child. And so we will do peer-to-peers with the ENT, with the dental, and also get blood work done at the same time. So we'll say, hey, we don't want your child to go through 3 different anesthesia hits. Let's try to do this all at once. So we coordinate that care. We will do, like I said, peer-to-peers. I've multiple times, talked to the anesthesiologist just to make sure, my kiddos with mitochondrial dysfunction get the right type of anesthesia, and then my kids with detox impairment have the right detox supports in place at least a week before, at least 2 to 3 weeks after. We're really pushing on, detox to make sure that anesthesia doesn't cause too many, delays or issues. And so those are the kinds of things that we do. We work with different providers. We try to take that on for our families. Instead of you guys being the one who are talking to all these providers who most of the time are not communicating, we try to streamline that care, and create one care plan for your child, because we're looking at the child holistically. We're not just looking at one section. Another thing that we also do with multidisciplinary care is having our families filter all the information to us, meaning if you are seeing 5 different providers, and sometimes it'll be in the same field, you might be seeing another functional doctor, you might be seeing somebody with, homeopathy, you may be seeing, all these different providers, and they're all telling you to do so many different things. And one provider has 20 supplements, the other has, telling you to do this and that. So what I usually say is filter that through us. Let us look at all the recommendations and make sure that nothing is doubling or tripling, because that's another thing I see when I first see patients. I'll notice they're on multiple supplements that are either doing the same thing or they're not getting enough of, and so that's something that we also look at, making sure that things are at optimal levels and dosing. And so, like I said, is we ask you to send all of those records. Anytime you go to a new provider, we ask you to send those records, look at them, and we will review them and let you know and say, in order, yes, we definitely think we should do what ENT is saying, and then we'll continue working on the gut imbalance that we've talked about, and then 1, 2, 3, 4. And I feel like that's something that just takes so much, stress off of the family and the parents, because it can be overwhelming when you have 2 to 3 providers or care plans and you don't know which one to implement. And so a lot of times my families will try to implement all of it at the same time, and our kids will have like a Herxheimer reaction, or they'll get constipated, and it's just not a pretty picture. And so that is why we truly believe the multidisciplinary approach is so important for our kiddos, because they are dealing with multi-system issues. And so they need somebody who's going to look at all those systems holistically and create a plan for your child. And that's what we do at Lighthouse. This next, I found this online, and I just thought it was so true for our population. It's, how healing with autism works. We hope, we want our kids to be the responders and go from A, B, C, just go in order, that linear approach. But unfortunately, that's not usually how it works. I'm sure you've heard the saying of the 2-3 steps forward, 1 step back with autism treatment and recovery. And that's truly what it is. There's a lot of twists and turns. Sometimes what happens is, we're making gains, with, maybe adding in some B12 and leucovoron, things like that. And then we have a gut protocol where we're killing parasites and yeast and bacteria. And our kiddos sometimes will have a Herxheimer reaction because they're constipated and they're not detoxing. And, and we have a Herxheimer protocol. We make sure all of the detox is in place, all the supports before starting a gut regimen, but it still can happen. And so sometimes, your kiddo, some symptoms may arise and it feels like they're regressing, but truly it's just, we got to work through those problems. We got to add in more detox support. And then usually, it's the continuing hopefully to move forward. This is one thing I just wanted to talk about, because I do feel like it really does pertain to like the multidisciplinary approach, but diagnostic overshadowing is a big problem, in our population, with the autism population. And really what this means is the tendency of a healthcare professional to overlook comorbid health conditions, so like the underlying issues I've been talking about, in the presence of a disability like autism or coexisting mental health condition. So what that means is you go into your pediatrician or you go into your GI and you're, saying, hey, my child is head banging, they're biting, they're stimming, they're all these issues. And they tell you, no, that's just autism. That's just accept it. Or usually it's, oh, that's behavioral. And then they send you to a behavioral therapist and tell you to get more ABA instead of truly looking at the comorbid health condition that can be producing that symptom. And one of the areas I've been doing a lot of research and study is, the GI system and, how it pertains to kids on the spectrum. And I found some pretty, alarming numbers for our kiddos on the spectrum. One of the studies shows that up to 91% of kids on the spectrum have GI distress. In 2014, the Mind Institute documented that children with autism were approximately 8 times more likely to suffer from one or more chronic GI symptom. And another study, the AAP also says that ASD, or children with ASD, have gastrointestinal disorders that may produce behavioral manifestations. So why are our kids not getting this medical evaluation when they're first diagnosed? If up to 91% of our kiddos on the spectrum have GI issues, and I can attest to that because I would say about 90% of my, no more, more have GI issues when they first come in. I think I've seen maybe 2 clean GI maps or GI effects test. But it's very rare. There's usually something going on. There's leaky gut, there's inflammation, there's some kind of dysbiosis. And usually when we treat that behaviorally, our kids get better. We see them improve. And so it's so important for us to look at these underlying issues. And also too, why the multidisciplinary approach is so important. So what sets Lighthouse apart? What makes us different, from any other clinic? One thing I will say we are very proud of is, we are parent providers. We try our best, not even just providers, but from front desk all the way to back office, to hire staff that truly understands this journey. Either they've dealt with their own health issues or have a child on the spectrum or have ADHD, POTS, dysautonomia, PANS-PANDAS, they've been through some of the treatments like IVIG or rituximab, so they get it. Our providers understand, what your child's been through. They understand the GI issues because they've experienced it with their own children. And I think that sets us apart, or that makes us a little bit different because we're very empathetic because we've been in your shoes. We've had sleepless nights. We understand when our kids only eat like 2 foods. So that's something we really strive to do when we're looking at who is going to be part of our team. Another thing is, we are available to our parents and have multiple avenues to contact us. Again, when we came together, when I met some other like-minded providers, one of the things we said is, what did you wish you had when you were recovering your child? Or, and one big thing was we all wish we had access to our provider, because when we would call our pediatricians, again, we got this is just autism, take it up with your ABA therapist or something like that. Or here's a referral to psychiatry if you want to, start some medication to calm them down. And so we wanted to make sure we were available to our families. And so we do have, an after hours and a weekend text line during the day. You can, call the office. You can contact us through, there's a patient portal that usually takes about 2 to 3 business days. So it's not really urgent. So if you have something urgent, we usually say, text the text message line. Usually within the same day, we'll get back to you through that. Because sometimes when you're going through something, when your kid is having, one of the worst flares, or they're, banging their head, they're biting, they're severely constipated, you want to have access to a provider who understands and can talk you through it. And our goal truly is to, if we can, to keep your child out of the ER or out of the hospital. So a lot of times what I see is, then they end up, being on hold or being admitted into a psychiatric ward. And that's never good for the child or the family. I know sometimes it is necessary, but if we can avoid that as much as possible by helping the family in real time, that's what we're doing. Another thing I think that sets us apart is that we do take insurance. That was something we all vowed, is that we wanted every patient to have access to this type of care. A lot of times, with biomed and functional, it can get really expensive. And so a lot of people don't have access to that kind of care. And so we did want to make sure we took insurance. It was not easy getting credentialed, but it was worth it. And if you live in the Colorado area, we do take Colorado Medicaid. So all of your visits can be paid through Medicaid. Also, we're very individualized. I talked about that earlier during the pyramid, but we do believe in individualized medicine that tailors treatments to your patient. One example I give is a lot of times I have multiple siblings or, children in the family, and I get where mom says, can we just give everybody the same thing? And I'm like, no, we're individualized. And, we're always surprised because, we'll do 3 different, stool tests, and one kid will have parasites, one will have yeast, and one will have both, and so we can't treat every child the same. We have to be individualized. We do treat the whole family. When we first started out, that wasn't the case. We actually only were pretty much pediatrics, but we kept getting the feedback where parents were like, I think I have those same issues as my child. Can you see me? And so a few months in, we hired a family practitioner that can actually see adults. We also have our functional psychiatrist, Dr. Wise, who also sees children and adults. And so we definitely can see, the whole family, including, senior citizens. And so that's something that we love, because a lot of times too, when we see people in the same family, we can make some of those connections and maybe find out if things are genetic or if we see a pattern. We do believe in implementing evidence-based practice and using the scientific approach. So we are really big on testing, treating, and then retesting. I have a lot of times where patients will come in and say, yeah, I have a GI test. And I'm like excited. And I'm like, okay. And I'm like, wait, this is like 3 or 4 years old. And so that's not something we can, treat off, especially knowing the microbiome changes, so much so quickly with different infections or factors, environmental factors. So we do ask for, recent testing. And if you have it, great, we'll treat off of it. And if not, we're going to run some of those tests in those labs. We are an integrative clinic, so we do combine the allopathic and functional medicine. We believe both together is really what brings true healing to to the patient and to the child. And so we do have an integrative approach. And so what that means is sometimes I may need to do conventional testing. We may need to do an EEG to rule out seizures, or an MRI to look if there's any infections in the sinuses. And all at the same time, we have to do some specialty tests. We may have to do an OAT, or, a GI map, or a GI effects, or a FRAT, or these other, specialty tests. But usually when we do both of these things together, that's when we're truly able to see the whole picture. We do have a multidisciplinary approach where you look at the child holistically. I've talked about that earlier. We have built a team of experts for consultation. And so what that means is, like I said, we have a great immunologist that works here in Denver. And so what we do is we, if we need to refer out, we'll do that. We've had a few of our protocols, signed off by certain specialty providers just to make sure it's sound and evidence-based. And we are actually in the process of growing that multidisciplinary team within Lighthouse. And lastly, we're a forward-thinking clinic. We're always looking for ways to expand our knowledge and expertise in the autism field. And so what that means is, like I said, our psychiatrist, Dr. Wise, he's also went back to school and became double board certified in functional medicine. I have another colleague of mine who right now is pursuing a psych certification. And myself, I'm actually in the process of receiving my doctoral degree. And so we understand and we know the power and the impact, the way to have power and impact on families and to grow really is with skill and education. And so we are in the business of helping people and helping children. And so it's important for us, to be having that kind of be forward thinking, to have cutting edge, evidence-based protocols and put those in place at Lighthouse. With my research, I'm going to be focusing really on diagnostic overshadowing of GI issues with patients with autism. And the reason why I feel like this is so near and dear to my heart, and why GI issues is so near and dear to my heart, is because number one, I see in the clinic how many of our kids, when we deal with those GI issues, they are so much happier. They're sleeping better, they're eating better, their focus is better, their immune systems are boosted. I mean, we see amazing change. And just kind of taking it back to a personal note, like I said, my son, he didn't sleep for years. Almost till about 4 years old. And I remember when he finally had the language to tell us, I said, I asked him, I said, hey buddy, like what was going on? Why were you waking up every night multiple times? And he told me, and I'm sorry, I get emotional sometimes, but he told me, Mommy, my tummy was hurting. And that always sticks with me because our kiddos sometimes don't have that language to tell us that they're in pain and that something is going on. Obviously, my mommy intuition told me there was something wrong, but now seeing the statistics, seeing up to 91% of kids on the spectrum deal with GI issues has just really fueled that passion for me to want to do research in that area. And my goal truly is, once I'm able to, finish my dissertation, I really do want to present it to other pediatricians with the, data and the information I have found, because I truly believe every child on the spectrum deserves a full medical workup. And if we can even just start with a full GI workup and just basic nutritional labs, I really think we can change, the paradigm of autism care and the way we treat it and the way in the diagnostic process. So that's my goal. That's, what I'm passionate about right now. So if you want to become a patient, or if you want to contact us, we have a few different, avenues. I would say number one, going to our website. We have a future patient section where you can click that. We're very transparent about, pricing, meaning if we don't take, we accept all major insurances, but for some reason, example, if you have like Kaiser, who's private, then we have, the other cash pricing that you can decide to do. We also have Medicaid discount rates. Those are not actually on the website, but if you call in and you do have out-of-state Medicaid that we can accept, we will give you a discounted price. We also have something called a monthly complex care fee. And again, the one on the website is not the discounted price. That's just, if insurance is not covering it. But we have found that the complex monthly fee is covered by insurances. We've been pretty successful with that. And what a monthly complex care fee is like I said, this multidisciplinary approach is a lot of work and it's time consuming, having to be the liaison and case management behind the scenes and doing peer-to-peers with your anesthesiologist or your dentist, or, even having a 24-hour service where we are, picking up after-hour lines and texting. The only way, we can afford to do that service is with this complex care fee, but that does at least give you, that service to have access to your provider at any time. If you have any specific questions, you can always call the clinic directly. I will just give you a heads up though. It's been almost a year and a half now, and we are a completely telemedicine right now due to the state of, with COVID, state of emergency. We were able to see patients in every state. And so right now, I think that was lifted last month. And so pretty much September's our cutoff. But the reason I'm mentioning that right now is because if you're calling in to, for questions, just know that we only have one person pretty much in the front office. And so sometimes, you may have to leave a message. If your questions are, how do I become a patient? Like I said, go back to step one, just fill out the intake paperwork, because we have a different team for that. And so we can help, we can get you in much faster that way. Lastly, you can always email us and at info@lighthousecomplexcare.com. For some reason, if I haven't answered any of your questions, you can definitely go there. And then once you become a patient, we do ask you to send at least about 2 years of health records to us. And so, or any pertinent information. So of course, things like genetics that are not going to change, we want you to send that information, but that will be through documents at lighthousecomplexcare.com. And all of that gets uploaded to your patient portal and you'll have access to that. Like I was mentioning earlier, the telemedicine laws have changed. And so I know right now with this new variant, I don't know where things are going. So telemedicine may be reinstated, but as of now, so in July is when it was lifted. Up until then, for about almost a year and a half, we were strictly telemedicine and we're able to see patients in every state. But now we've been limited to just these green states, as you can see. And so what that means basically is if you're in one of those states, you don't have to worry, we can see you. If not, I do recommend, patients maybe going to one of the driving into one of the neighboring states. So we can see you. You don't have to be seen in person. You can do telemedicine, but you have to physically be in the state that we're actually licensed in. It is a little bit of a silly rule, but that's, we have to abide by those rules if we want to continue doing telemedicine for our patients. If you're able to come in person, our providers are in different states. So we do have a provider in Texas. We have a provider in Florida. And then there's 2 of us here in Colorado. So if that's more convenient, when we do open back up our clinic, we're probably going to start having like one week where we have families come in and I see you guys in person, and then from there we can figure it out. We are in the process of getting a few more licenses, like in Georgia and Ohio. And that's because we have a very large patient population there. So it's worth getting, our licensing and credentialed in that state. The other work around this is, something else that you can do is if you call our office, like say you're from New York and you're like, can you get licensed there? So our rule basically is if we have at least 15 to 20 patients in that state, then yes, we will pursue a license in your state. But that to make it worth it for us, like it can't be 2 or 3 people because, keeping up with licenses and, paying all of that, it's a hassle. And so we do ask at least to have 15 to 20 patients. So if you call in and, ask our front desk and say, hey, how many more do you need for New York, for them to pursue a license, and they tell you 3 more and you find 3 people to sign up, then we will get a license in your state. But again, if you drive to one of the neighboring states, we can still see you via telemedicine. We are happy to offer international services also. So I have patients from Europe, Canada, India, from all over. And so with our international patients, we are still able to ship out specialty testing to them. And we don't have the international prices online. And the only reason is because, with currency and the different pricing, we've pretty much broken it down. Depending on what, country or where you live. And so if you do want specific pricing about that, you could definitely call in or even just email us. And so this concludes my presentation for today. If you want more information, feel free to go to our website. You can call us, email us. And again, I just really want to thank, the Autism Research Coalition for having me today. I really appreciate your guys' time. And I think there's some questions. So I want to open it up to you guys if you have any other questions about, what we do at Lighthouse or our multidisciplinary approach.
Absolutely. Thank you so much for sharing both your personal story and just you've answered most of my questions that I already had written down, just checking them off. So that's always very nice. I think there's so many people that are listening right now that absolutely can relate. I know I can relate when you were just giving your beginning story. I was like, oh, were you in my house? So I know there's so many people that can relate to your story on a personal level. So thank you for sharing that with us. I have a couple of questions here from people from the audience. Sure. And one is that we would like to know if you're open to share, obviously with not personal information, but if you could give us maybe one of your example cases that you've been working on that was maybe how they presented, we know your approach, your pyramid approach, but how they presented and how they're doing now, just to kind of give people an idea, what you've done.
Yeah. Let me see. So you want a specific case or?
If you can, I know that might be.
I know. I didn't really come prepared, but what I'll say is, usually I can give kind of what I usually see in the clinic. Okay. And so one of the major issues, again, like I said, is GI, and a lot of times what I've noticed is kiddos who have, infection overload. So we will see kiddos who come in and have, H. pylori or have, C. diff infections or strep overload. And usually what I see is that with gut health, we may notice a lot of behaviors, calming down, better focus, better attention, and, help with, like I said, with opening up their palate and eating a little bit more. Something a lot, I see usually with kiddos who have a lot of nutritional deficiencies, the progress I see there, again, is a lot more attention, adding in some zinc also can help with their diet. And so that's usually what I see when I start treating them for, nutritional imbalances. Frat, is probably one of my favorites just because it is, again, so tangible, so easily treatable. Either the antibodies are positive or negative, or you have, the floating cerebral folate. And so if that is happening, with that treatment, usually what I do see is language. I see a burst of language. I see a lot of cognition, where kids who weren't really following directions or understanding start following, 2-3 step questions. That's usually where I'm even, adding in some B12. One thing I do see a lot in our population is when I, have kiddos come, they may be on really high doses of folate, but they're not on any B12. And so folate, needs that B12 to be utilized, and so that's one thing where we'll go back and say, hey, let's add in some B12, some injections, or, sublingual or even intranasal. And that's where I see way more speech come in when we add that combination of the B12 and the folate together. The other area is the mitochondria, and the progress I see with mitochondria. Again, I can't think of just right now specific patients, but what I usually see with the mitochondria, like I said, is kiddos really being able to have, like I said, more motor function, being able to do gross motor, because it is, affecting, muscle tone. Kids who are failure to thrive start, gaining weight. And then with infections, especially my PANS-PANDAS kiddos, kiddos who were suicidal, OCD, very restrictive eating, we start seeing a relief of those symptoms. I see one of the examples, I guess I can give a specific patient, is I remember he came in with flaring, and we did a lot of testing, and we did do the full, PANS-PANDAS, we ruled all that out, but his infection actually was a raging C. diff infection. And this kiddo, I guess, had it for probably over a year, because that's when he became symptomatic. And when we finally found it, mom was like, oh my gosh, I remember having C. diff and I was treated with vancomycin, but he wasn't symptomatic, so I didn't think anything of it. But when she thought back, she's like, it was within a month where these symptoms arose. And so it's not always, infections systemically in the blood, like Lyme or co-infections. It could be in the gut. It could be strep in the gut that is, causing some of the PANDAS symptoms. And so for this kid specifically, I remember we treated the C. diff and he stopped hearing voices. His OCD completely subsided. And he made so much progress, and continues to make progress. But in the interim, we still checked for mitochondrial issues, which he had, and we had to, correct that. And every time we made more and more gains. And so that was an amazing case to kind of see how treating the underlying issues truly helped him to come off of his psych meds, even because he stopped hearing the voices, the depression was gone. He was older, he was a teenager, and he had gone back and regressed to sleeping with his mother. And now he's able to go back to his own bed. So that's something that I do remember. And then moving forward, IVIG, looking at the immune system. Some of our kids with autoimmune encephalitis will need that IVIG or will need rituximab. And so a lot of times what I see with that is, their immune system, balancing out, a lot of that dysfunction, starting to come back to homeostasis. And then what's the other area? Mold exposure is really huge in our population. So when we treat mold, I usually see a lot of kids, have better focus. I feel like infections, start subsiding just by treating the mold, because that's been really suppressing their immune system. And so that's another area that I do notice. And then the last area, is our neurological reorganization. And basically, that's kind of like what we see at the end, is where therapy, starts saying, hey, what are you guys doing? Like, this child is making amazing progress. We've been working on this for 6 months with nothing. You know how those ABA graphs go, and it's like just going up, up, and up. And so that's usually what I see kind of when we get to that stage. One of the questions I usually get is, how long does this all take? On average, I would say it takes us about 1.5 to 2 years to really get our kids, to homeostasis and good health. That doesn't mean, every child's going to recover, but recovery looks different to each patient. For some of my families, recovery just means they want their child to be independent. Some people want, speech. Some people just want their child to be able to say, I love you, or just to have any kind of, even if it's nonverbal. And so it looks different for every patient, but usually to kind of go through all these issues and look at the underlying, comorbidities takes usually around 2 years. And especially the gut, that takes sometimes 3-4 rounds to get all those infections and to heal that leaky gut and to get them into a good place.
Wonderful. Yeah. I mean, I'm assuming you have a couple of people that are your patients already, and so many people have wonderful things to say. I wish I could get all the people. Like Anna is saying, we're patients, they're the best. So we have some parent testimonials already that are very well known, actually, in the Autism Coalition. So that's wonderful. So yeah, well, that's amazing. I just want to see if there's any specific, because I know your time is precious as well. And one person was asking, actually a couple of people, about Mido. Like, how do you approach Mido? I mean, obviously it's going to be different with each child. You test, and then you would probably retest after you do your protocol. But
Yeah. So with the mitochondria, the gold standard we have is, the Mito swab. Usually we go by the Mito swab that has that about, I think, 70 to 80% correlation to muscle biopsy. And so what we do is we test that. We look at the citrate synthase and the 4 complexes. And depending on what area, what complex your child is deficient in, we try to upregulate, or if they're, really high, we're trying to balance that out. And so we actually like to use, the study from Dr. Rosignol and Dr. Fry about, the primary and secondary mitochondrial dysfunction. So we look at their dosing, and depending on what area is affected, that's what we use pretty much. And so like if it's a complex one, we may use like some CoQ10, or if we have a low citrate synthase, we might use some PQQ to kind of raise up that citrate synthase. So it really just depends on what the deficiency is and what complex your child has. And I would say, or what dysfunction, your child has. I would say we don't usually retest right away, because it does take about 6 months to a year to really upregulate that mitochondria. So we create something called a mito cocktail, which I'm sure a lot of people have heard of. And basically what that means is, we're building those supports and we're getting to optimal levels. And once we do, and once, we're seeing improvement about 6 months to a year, that's when we recheck the Mito swab at that point.
Okay, that's great. That's great information. And then finally, what is the most ideal, sorry about that. What is the most ideal parent to work with? Because obviously I know you're focused on those kids. I mean, that's your goal, but really, of course, this is it's also multidimensional with the children and with the parents. It has to be like a team effort. So what is that like? What does that look like for you when you're kind of addressing the parents that might be scared or might think that, maybe this isn't working, etc. But what is your approach to the parents?
So my approach to the parents, and like I said, because we are all parent providers at Lighthouse, we're very empathetic. We've, with our own children, have all hit some walls, but what we always do is, say we hit a wall, or say we, see some regression. What we do is we come back and we regroup. So a lot of times those families will say, hey, can we, maybe they're at 6-week follow-up. Like, hey, can we do a 2-week follow-up, or every 2 weeks till my kid gets back to a good place? And what we do is we brainstorm. And usually when I go back and ask, the number one culprit I will say is constipation. And I'll ask, like, when's the last time, and they're like, we don't know, and then when they start tracking it, kids are not going for 3 to 4 days. And you'll be surprised when, we treat constipation, how much our children can improve and how much, progress you can see. And so really the most ideal, I would say, parent really is someone, obviously who's open, is asking questions. My favorite, I think, is I love families who are asking why. Like, why are we doing this testing? What's the point of this? I'm really big on, like, during a telemedicine appointment, I usually will open up, I'll do a screen share of your results. And so say we're going over an oat, I'll go over that first section, and, if there's high yeast markers, I'll say, okay, we're going to go through this. And then we'll look at the bacterial markers, we'll look at the oxalates, the mitochondrial markers, so forth, so on. And so I like that interaction. I like, parents asking section by section, like, what does that mean? Because to be honest, when I was going through this journey, I would say one of the things that was hard is when I would ask sometimes those questions, it'd be like, just don't worry, just do the supplements, it'll be fine. And so I actually like when parents want to know answers. I have a lot of very educated families, a lot of, physicians who, and I don't blame, like, again, I came from this background, so we don't learn this, in school. A lot of, doctors are not learning this in medical school. And so they're asking and they're wanting, the evidence-based articles. And so because, we have that research team, that back office, I will send articles, any information I have, anything about maybe their immune system dysfunction, I'll send information. And also what I do love is when parents interact with us, meaning anytime they find a new article, sending us information and saying, look, did you hear about this? Or there's this, cutting edge treatment. What do you think? And so I love that. And then the last thing I would say about my most ideal patient is, I always say, and I said this even before I got into this field, is like the parent knows best. You know your child better than anybody else. So if you have an intuition, if you're just like, you know what, I really think my kid is dealing with Lyme, or I really think my kid has, strep, I've been reading about it, then I'll test, we'll test for that. And sometimes it might not be, in that actual pyramid or that order. I might add that to the next blood work just to kind of rule that out. And I'll say a majority of the time it comes back positive because, parents have that intuition, they know. And they're the ones, researching and reading. And so I love that. I love when parents are interactive and know their children and kind of, sometimes even guide to help us to say, I've been seeing this. Do you think so? And it makes me think like, yeah, it could be, and so we start brainstorming together.
Awesome. Well, everyone's very excited. I'm hoping that, we're just so appreciative of you coming and speaking with us, just giving us your approach. It just sounds, at least to me on a personal level, it just sounds like you're hitting all the boxes, obviously on a personal level. So, you're passionate about it. And that's kind of our favorite, is someone who has skin in the game, who's been there, who knows what it takes, and who also is, compassionate with our kids. So thank you so much for meeting with us today. I'm sure Enrique is going to put up all the information if people need to contact you on the board. And thank you so much again for speaking with us. And we hope that
thank you for having me. I really appreciate it.
Yeah, that we just continue to help our kids. We really appreciate it.
Yeah, that's the goal.
Have a wonderful weekend.
Bye.